Hello everyone. My name is Neha, and welcome to Book My Therapy. Today we have on board Syeda. She is registered social worker and psychotherapist in Ontario, practicing for over 10 years. And the range of topics that she specializes in ranges from anxiety, trauma, depression, domestic violence. She also caters to people who are above age of 18, and she comes from South Asia. Therefore, seeking counseling with her would mean that she understands the cultural nuances and where you're coming from. So, hi Saida, and welcome to Book My Therapy podcast. So happy to have you on board. To start with the podcast, I have a quick question for you. So, when we speak about mental health, usually people think that there is awareness about it or the lack of it. So, what's your take on this?
Hi, viewers. Thank you for giving me an opportunity, to talk about the awareness and, how at least talk about awareness in terms of mental health because we are feeling like a lot of work need to be done in this area, specifically with, South Asian community or population. Uh, Raising mental health awareness can help people to understand the symptoms of mental health, basically, right? And so we want like people learn how to seek help in this regard, either like a medical or professional help, right? And to break mental health stigma related to mental health generally with with the South Asian population. And there are many steps need to be considered in this regard in terms of mental health, raising mental health. We need to definitely talk about openly about this concept. One. Second, we need to, continuously, maintain this conversation, this discourse with different level, different status of the society, right? And we need to consider children's learning about mental health. We need to consider not let it out, the children's right out of this discourse and this discussion, because this is our future. We need to focus on that. If they have any concerns, if they have any questions, if they ask something about mental illness, adults need to be understand and give them some insight about it is a real illness, and we need to address the lessons, similar like we are addressing sometimes kidney diseases or any other physical health diseases we are considering, right? So we need to consider this as well. And we need to maintain, you know, bring up some assessment and screening and different kind of intervention specifically, so we need to use maybe our social media sites, different channels we are using nowadays. Everyone is using different kind of social media avenues, so we need to consider it should be at least mental health assessment. It's like with maybe sliding scale, we can say that maybe some subsidized rates we need to consider, because it's very important. Otherwise people, because nowadays everything is specifically health related concerns are seems, because it's not covered here in this country, right? So we have to consider, we have to share different kind of a screening and awareness tools, right, in a subsidized rate. We have to definitely learn about the stigma and discrimination related to mental health, and we need to address this. And as a community, as if not necessary, everybody needs to be a social worker, everybody needs to be a psychotherapist. No, but at least we can, as a South Asian community, we need to participate in different kind of advocacy programs, different kind of volunteer programs to raise this awareness in terms of mental health. Not necessarily we need to celebrate a month for mental health. Mental health is a reality. It's a real challenge, right, for everyone. And it not necessarily like children are, our youth are struggling with different kind of mental health issues, or women are struggling, couples are struggling, aging, people, are struggling with a lot of things. So we need to consider this is a real problem, real challenge, and definitely we need to take care of all these things.
Yep. So when you speak about struggle, what are some common signs of mental distress that we should be aware of in ourselves and in our loved ones? And how can we approach someone when we are concerned about them in a supportive and non judgmental way?
Yeah, because it depends on different situation, and being a immigrant in this country means everybody has been gone through or going through a different kind of transition in their life, right? Either a children, a woman, a man, aged people, a lot of things, right? So there are many cultural problems are there. I can say that cultural transitions is also very difficult, right? Weather is a kind of a challenge, right? A lot of things, right? Upside down, right? In terms of transition, we are considering. So means everybody, has certain level of stress, struggle, is there for everyone, either for the children or everyone, as I said, different strata of the society, specifically in South Asian population. So, sorry, what is your question about the struggle?
Yes. So, what are some common signs that we must be aware of um, when we are facing it for ourselves and our loved ones? And when we speak about signs, and if we notice that, there is certain mismatch, or, there is a pattern, how can we approach ourselves and our loved ones in a supportive and non judgmental way upon noticing those signs?
Yeah, for example, if you are considering a non-judgmental, approach, like similar to any other physical disease, are we, considering, or are we, having some judgmental attitude or judgmental
Mm.
behaviors towards physical illnesses? The answer is no, right?
Yeah.
Means same manner we have to consider. Yes, there are some very warning sign, I can say that, or so we can recognize, anybody can recognize if someone is struggling with sleep, insomnia, right? You can say that from last 6 months, right?
Okay.
If you are considering lack of appetite, or not feeling hungry, right? Most of the time skipping meals, right? Poor hygiene you can consider in terms of a very common uh, condition, right? um, uh, Dramatic mood disorder you can consider, right? um, Illogical conversation, right? Isolation, not taking interest in different activities, um, anger at some point, right? um, Missing school, work on daily basis, right? It's, and if it is a pattern from last few weeks or months, we need to consider why it is happening. Overthinking, depressed, low motivation, right? Losing interest in different thing, withdraw from people, right? So there are many things we are considering. These are very common one, everybody can notice easily, right? If their loved ones is struggling with something, means we need to consider why it is happening. Maybe we need to, the first and most important thing is connect with your doctor first, right? And then if he or she suggests you to have some assessment or some kind of further medical assistance, we have to pursue this, right? Without hesitation, because social support is very much important in this mental health throughout the journey, right? uh, Support from understanding, at least. I'm not saying like similar like behavior, we are taking care of our loved ones when they are struggling with any physical illness, right?
Yeah.
So in a very similar manner, so we have to accept basically mental illness is a part of the illness, right? Is a kind of a illness like physical illness.
Yeah. Very well said, actually. Because
Mhm.
sometimes we take it for granted, right?
Yes.